the World Health Organization, about 2.3 million women are diagnosed with breast cancer yearly. And in about 95% of the countries, breast cancer is known to be the first or second leading cause of female cancer deaths. And on that note, I welcome you to a brand new episode of the Catholic Faith Forum, brought to you by Dominican Media. I am Mariana Utam, and on this topic, we're going to be having a very informative interaction. Today, we're talking about breast cancer, and with me in the studio, I have a wonderful guest. But you won't know who that person is until we go on a break and come back. So stay tuned.
Today, I'll talk about a key variable that each of us have mutually in common, our health. Now, when I mean taking care of our health, I don't just mean avoiding things that can cause us illnesses or sicknesses, but rather activities and routines that will promote our mental capabilities, improve our physical attractiveness in order for us to live our best life. Self-care is not being selfish. Rather, it is a necessity that by managing stress, relaxing more often in order for us to improve our spiritual and physical life. Now remember, our body is a gift from God, not just about taking care of our soul, but also our body.
Welcome back, Saints. It's still that informative episode on the CFF, which is the Catholic Faith Forum. And as I said before we went on the break, we're going to be talking about breast cancer today. Who is with me on the show? Well, you can't guess because you will definitely not get it. I have with me a seasoned medical practitioner by the name Mrs. Agatha Wapmok. Welcome to the studio, ma.
Thank you for having me.
Thank you very much for joining me on this episode. Yeah, thank you very, very much. So we're going to be talking about breast cancer. We know a lot of people have been diagnosed with this particular form of cancer, and it's the leading cause of female cancer deaths. So we need to really get the information out on how to prevent it, how to, get diagnosed, how to get early treatment, and that is the purpose of this particular episode today. So yes, first off, let's start with what is breast cancer.
Okay. Thank you for your question, and thank you for having me on your show.
Yeah.
Breast cancer is cancer of the breast.
Okay.
And so it results from abnormal, uncontrollable growth of breast cells. So like within the breast, there are different cells. There are cells called, that make up the lobules, which form breast milk. There are cells that make up the ducts that connect the lobules to the nipple to transport milk. So those are ductal cells. So abnormal growth of any of those cells or that from the connective tissue of the breast is what causes cancer, and it can be fatal. So it's something that develops over time. Okay. And it's a disease of public health importance. Why do we say it's a disease of public health importance? Because it's associated with high rates of sickness and high rates of death. In the year 2020, it was reported that there were over 2.3 million diagnoses of breast cancer globally, and with over 680,000 deaths. So that's alarming. And when you come down to Nigeria, we have over 28,000 diagnoses of breast cancer in Nigeria, which is way above what we have for cervical cancer, which is 12,000 yearly. So that makes it the commonest cancer, and it's associated with high rates of death. So that's why it's very important to us as a public health problem.
Yeah. Okay, so are there symptoms, like there are definitely symptoms of breast cancer. So what are they?
Okay, so the symptoms vary. So that's why we create awareness on such forums, because we have varied symptoms, and it could range from external symptoms which you can see, and then some symptoms which you can feel. So by seeing, when you look at the breast, if you notice change in the size, shape, color of the breasts, then you will need to see a physician to confirm, to assess you properly. There could be changes on the nipple. If you notice escoriations like skin peeling off or dimpling on the breast. So those are some symptoms, but that does not necessarily mean it's a breast cancer. So that's why the final diagnosis is usually made by a professional. So that's part of the symptoms. So by viewing, you can assess if there's a change in the size, in the shape, you know, in the color, because there could be redness, there could be dimpling, and then inversion of the nipple. Like nipple is supposed to protrude, and then sometimes you could see it retracting. If normally it has always been protruding and you notice it retracting, then you would seek medical care. And aside from that, when you go further to feel, there could be lump. So that's usually most of the symptoms that make people present in the hospital. Like no matter the size of the lump, it could be a small lump, you know, it could be a big one, so lump, and then discharge, bloody discharge from the nipple could also be a symptom of breast cancer. And then if you have a breast cancer that has spread, you could have other systemic problems that is not limited to the breast. There could be bone pains if it has spread to the bone. There could be cough if it has spread to the lungs. There could be weight loss, and then other symptoms like fever. So it goes from the local, which is the breast, and then could go systemic as well.
Okay, so talking about diagnosis right now, we've heard from other awareness campaigns and awareness groups that self-diagnosis should be done frequently. So what is the process of self-diagnosis?
Okay, so I would not say self-diagnosis. Diagnosis is usually made by a specialist. So the individual does the screening. Screening. So that's what we encourage. We call this self-breast examination, SBE. So anytime you come in contact with a doctor, most especially public health physicians, I'm a public health physician, so this is what I do a lot. We create awareness, and then we're more for prevention of diseases, promotion of health and prevention of diseases. So when you come across any one of us, we will definitely teach you how to do a self-breast examination, because that helps in early detection for institution of early treatment, and so there will be better prognosis from it. So this self-breast examination is what we encourage every woman to do every month. Every month, there will be a particular time. You would know what your cycle is. There will be a particular time. So we usually encourage women to do it between the, let's say, 6th to 9th day of her cycle, because during menstruation, the breast is usually lumpy. So you would have a false alarm. Maybe when you feel the lumps, it's lobular. Or if you do it during ovulation, the breast is also lobular with lumps. So you would have a false alarm. But when you do it between the 6th to 9th day of your cycle, you would be able to assess it properly. And so this self-breast examination helps you to assess, because when I talked to you about the symptoms, I said your sight, you could detect some symptoms. So you assess visually and then also feel. So when you want to assess visually, a woman is supposed to stand in front of the mirror. Stand in front of the mirror, and her breasts will be exposed. She'll be exposed to the waist. And she stands, she would view the breast to see if there's a change in size. In shape, in color of the breast. Usually one breast is a little bit bigger than the other. So when you do this regularly every month, you know what is normal. And so when there's something abnormal, you'll be able to detect that. And so when you do that, you could also stand with your hands on your waist, you know, to help you assess properly. And after that, you would lie down, use the left hand to examine the right breast, and you use the right hand to examine the left breast. And when you lie down, when you want to examine the left breast, you put your left hand behind your head, and you take the right hand. You use the flats of your hand and check round the breast, looking for a lump. That's after visualizing, looking for a lump. And if you feel any lump, you present yourself at the health facility. And when you're done, you also check your armpits, because some lumps appear in the armpit. There's an extension of the breast tissue at the armpit. So you do that. And when you're done, you do the same for the others. So with that, so many people are able to detect very little lumps, and it has led to early detection, diagnosis, and treatment to save lives.
Okay, thank you very much for that one. But we'll be going on a short break right now. And on this break, we'll get to know who the Saint of the Week is. Over to you, Mary Ann.
Our saint of the week is Saint Andrew Dong-Lac and his companions. Now, you may know him as Saint Andre du Lac. Saint Andrew Dong-Lac was one of the 117 Vietnamese martyrs, a group of 17th and 18th century martyrs who died for their faith in Vietnam. Born around 1795 in Bac Ni, Vietnam, he was ordained as a priest in 1823. Despite the ongoing persecution of Christians in Vietnam at the time, Father Dong-Lac remained steadfast in his faith and continued to minister to his flock. He no agree for anybody. In 1839, during the reign of Emperor Minh Mang, a severe persecution of Christians broke out. Father Dong-Lac and many other priests, catechists, and lay people were arrested and subjected to torture and imprisonment. Now, despite the suffering inflicted upon them, they refused to renounce their faith. Father Dong-Lac and his companions were eventually brought to trial, where they were given the opportunity to recant their beliefs and avoid execution. Guess what? They remained resolute in their commitment to Christ and chose to accept death rather than deny their faith. No grief for anybody. On December 21st, 1839, Father Andrew Dong-Lac and his companions were martyred by beheading in what is now Hanoi, Vietnam. Their courage and faithfulness in the face of persecution have inspired generations of Christians around the world. In 1988, Pope John Paul II canonized St. Andrew Dong-Lac and his companions, recognizing them as heroes of the faith and models of Christian courage and fidelity. They are venerated as saints and martyrs, and their feast day is celebrated on November 24th each year. The example of St. Andrew Dong-Lac and his companions continues to inspire Christians to stand firm in their faith, even in the most challenging circumstances. Are you ready to stand firm to your faith? Let's pray that St. Andrew Dong-Lac and his companions continue to intercede for us.
Thank you very much, Mary Ann, for the Saints of the Week. And back to the topic of the day. Today I said it that we're talking about breast cancer, and in the studio with me is Dr. Wapmok Algata, and she's deliberating, she's talking about this particular topic, breaking it down into bits and pieces, and we're going to be very much informed. So yes, back to the questions, ma'am. There are causes of breast cancer, so what are they?
Okay, so we wouldn't talk directly about the causes of breast cancer. So we talk about the risk factors.
Okay, risk factors.
It makes one more liable to get breast cancer.
Okay.
So those are the risk factors we talk about. And among these risk factors, being a woman is a risk factor because from the statistics I gave you earlier, it's only 0.5 to 1% that occurs in men. So the rest is in women.
Yeah.
So being a woman is a risk factor for breast cancer, and age. The older one gets, the more risk of having breast cancer. So breast cancer is commoner among women 40 to 70 years of age. So age is one of them. And then history of breast disease in the person. If one has had a history of any form of breast disease in the past, there's the risk, the likelihood of getting breast cancer is higher in that individual. And then the history of having breast cancer in that same individual, you know, there's an increased risk of having that. And then prolonged use of oral contraceptives before having the first baby has been implicated too as a risk factor for breast cancer. Then there's a drug that has also been implicated as a risk factor for breast cancer. Then when we move further, we talk about family history. So that's why when you come to see your doctor, they would ask you if there is a family history of certain diseases. So families whereby there has been history of breast cancer increases the risk, especially first-degree relatives. There is a risk, an increased risk of having breast cancer. And then lifestyle choices like obesity after menopause has also been implicated, and use of hormonal replacement therapy, because some people use undergo those hormonal replacement therapies post-menopause for certain reasons. It has
Okay.
also been implicated as some of the causes. Apart from obesity, harmful use of alcohol and smoking has also been implicated there. Then early onset of menarche, that's the first time a woman starts menstruation, early onset of menarche and late menopause, which means you're exposed to high amounts of estrogen and progesterone over a long period of time, has also been known to increase the risk factor for developing breast cancer.
Okay.
However, there are some people that have been diagnosed with breast cancer that don't have any of these risk factors apart from sex and age.
Okay.
Yes.
Okay, so can a nursing mother who has been diagnosed of breast cancer, can she still breastfeed?
Okay, so its treatment is based on individuals.
Okay.
You know, you individualize your treatment plan for each patient. So the attending physician will definitely assess your patient. When they assess the patient, which they will determine the type of cancer, determine the stage of cancer, and what kind of treatment they will institute. And when they assess that, because if she's currently undergoing chemo or radiotherapy, that will be difficult for her to continue breastfeeding as at that moment. But if after treatment, maybe they, one of the breasts is unaffected, she could, depending on her clinical state. Do you understand? So you have to assess your patient and know the capabilities of that patient before you would recommend that she continues breastfeeding.
Okay, so at this point, are there, it is said that, or rather, it probably is a myth, or, you know, just a narrative that goes around. When you rub ash, it reduces ash on the breast. It reduces your chances of having breast cancer. Is that true?
I've not heard about that, really. So it's,
yeah, probably just a rumor.
Probably a myth or something.
Okay, so at this point, it's been debunked.
For me, I wouldn't advise that.
Okay.
I wouldn't.
Okay,
Yes.
so does breastfeeding generally reduce the rate of, you know, does it reduce you having breast cancer?
Yeah, so studies, you know, a lot of recommendations are made based on studies. So studies have shown that there is a 4.3% reduction of the risk for breast cancer among women who breastfeed for 12 months. So it's, yes, so a lot of studies have shown that. And so, yes, it has a protective factor against breast cancer. And during breastfeeding, there's a substance produced that lyses tumors. So, you know, we call cancer cells to tumors. So it has a protective factor against breast cancer.
Okay, thank you very much for that one. We'll be going on a short break right now. And on that break, we'll be getting to know more about our faith. Over to you, Jeffrey.
Hi there. Were you taught in catechism that there are various types of mass? Well, if you know, thank God. And if you don't know, relax, we got our day. That's what Know Your Faith is here for. Hi Saints, welcome to a mind-opening episode of Know Your Faith. My name is Jeffrey and today we'll be learning about the types of mass. The two basic types of mass are 1. Low mass, 2. High mass. Now other types of mass are the solemn mass, the votive mass, vigil mass, pontifical mass, and concelebrated mass. Now I'll be explaining the two basic types and the rest will be explained in future episodes. Stay tuned. Alright, so what is low mass? A low mass is a mass that is entirely read or spoken by the celebrant. No parts of the mass are chanted or sung except the hymns, obviously, which may be sung by the congregation and by the choir. The celebrants may even lead the singing of the hymns, and sometimes music may be played softly during certain parts of the mass in order to help create a more uplifting atmosphere. Low masses are generally celebrated during the week and on Saturdays, especially when only a small group of people are expected to attend. Now let's look at the high mass. High mass is a mass that has some of its parts chanted or sung by the celebrant, which includes some parts that are sung responsively between the celebrants, and the congregation or the choir. Now, at the high mass, music is played and hymns are sung, unless prevented by circumstances. A high mass is scheduled for every Sunday, each holy day of obligation, and certain major holidays. Any day there is more than one mass celebrated, the high mass should be prominent and celebrated when the most people are expected to attend. So key things to note, guys. 1, the 2 basic types of mass are the high and low mass. 2, other types of mass are the solemn mass, votive mass, vigil mass, pontifical mass, and the concelebrated mass. 3, the low mass is a mass that is entirely read or spoken by the celebrant, while the high mass is a mass that has some of its parts chanted or sung by the celebrant. Sung, spoken, major difference. Now, another major difference between the high and low mass is the chanting and singing allowed in the high mass and not in the low mass. Alright guys, thank you for watching this episode. Do well to share to your friends, like and subscribe to our YouTube channel at Dominican Media. Till next time, be bold, be Catholic.
Welcome back, Saints. It's still Catholic Faith Forum, and with me is Dr. Agatha Wapmok, and we're talking about breast cancer. So if you've been watching, well, you haven't missed so much because we still have more information to give you today. Okay, so what are the stages of breast cancer? Yeah.
Okay, so yeah, there are different stages of breast cancer, and that determines the outcomes usually when picked up at certain stages. So there are various stages of breast cancer, and so for this kind of scenario, so I would categorize it as the non-invasive.
Okay.
You know, it's within the tissue of the breast. It's limited to that tissue of the breast.
Okay.
So it has not gone anywhere yet. So, and if picked up early, usually it can be addressed, you know, without much complications.
Okay.
And then apart from that, then we have the invasive cancer, which can, you know, spread to other tissues.
Okay.
And one of those places it spreads to early is lymph nodes. The lymph nodes, regional spread, you know, the lymph nodes draining that lesion, because cancer cells can spread through the blood or the lymph nodes. And so it can spread to those lymph nodes. And then we have another stage where it spreads to other organs, other organs of the body. So we call that metastatic stage. So these are the simple stages. But when you go further, you know,
there are
stage
more
1,
complex
stage
ones.
2, stage 3, stage 4. So there are different kind of categorizations.
Okay.
But this is simpler.
Okay, so what are the preventive measures against breast cancer?
Oh, yes. So, like I would always say, as a public health physician, that's what we love to do. Because of our limited health resources, you know, prevention is always better and cheaper than cure. We don't have the resources to treat a lot of people for cancer. So prevention gives greater impact. And so how to prevent breast cancer? One of such things is what we're doing now, creating awareness.
Yeah.
That's the first thing. And after that, we also talk to women about screening. Screening is aimed at early detection of any form of disease to institute early treatment so it does not progress to a complicated stage.
Yeah.
So how do you do this early detection? Is by screening. And first is by self-breast examination, because if every woman carries out self-breast examination every month, you will detect the earliest change, and then you will seek medical help on time. And so those are basically things you do for prevention. Apart from that, lifestyle modification. I mentioned that obesity after menopause has been implicated. Harmful use of alcohol and tobacco use has been so, you know, increase of physical activity, you know, decreased sedentary lifestyle will help in maintaining your weight. And then little or no alcohol, and and then we discourage the use of tobacco, and so it will help a lot in prevention of breast cancer.
Breast cancer.
And then non-use of hormonal replacement therapy
Okay.
can also help with this.
So what are the treatment options for breast cancer?
Yes, so for breast cancer, there are different treatment options, and it can be individualized based on the stage of the cancer, based on the clinical state of the patient. So there are factors to consider when you want to treat for breast cancer, and I will just outline the major treatments that are being carried out for breast cancer. So one of it is surgical treatment. Surgical treatment could involve removal of part of the breast or the whole of that breast. It depends on the stage of the cancer. So it could be mastectomy is removal of the breast itself, or lobectomy is removal of a lobe or what is affected. So depending on the stage of the cancer. And then chemotherapy, use of drugs, medical treatment for cancer to kill the cancer cells. Radiotherapy is also recommended too for treatment of breast cancer. It kills microscopic cancer cells that surgical methods couldn't have removed to prevent reoccurrence of the cancer. And then there are use of other biological agents too as well in the treatment of cancer.
Okay. Okay, so that was a wonderful presentation you've given us already. You've outlined a whole lot of things coming down to risk factors, to the preventive measures, down to treatment, and I'm very sure my saints out there have been well informed. But saints, well, we've come to the wrap of this show, and at this point in time, as a woman, you're going to be doing a regular breast screen. You're also going to, from 40 years and above, you're going to be making sure you have a mammogram. These are very important things you should do. And also don't forget, alcohol intake also is a risk factor to having breast cancer, the use of tobacco, and a whole lot of other things that Dr. Wapmok here has mentioned. And thank you very much, Ma, for gracing us with your presence on this show. Thank you very much for coming here to inform us and to also push out that awareness for breast cancer. Thank you very much.
Thank you too.
Yes. And yes, back to you, our viewers. Thank you very much for watching this episode. We hope you like, comment and subscribe to our page because it's very, very important. We need to be here to also still give you more important updates. Follow us on every social media platform, Instagram, Facebook, Twitter, everywhere at CFF on TV. Don't go anywhere. Don't unsubscribe because we have more important episodes for you. Till next time, keep being saints in jeans and shirts.